Hello, I'm here with Dr. David Minkoff. He's the medical director and co-founder of LifeWorks Wellness Centers. Wow, it's such a pleasure to have you here.
Thank you. It's good to be here.
Yes, so much to talk about in such a little bit of time. Tell me really quickly, I mean, how do you even begin to talk about your clinics? They're world renowned.
Well, thanks. We started about 20 years ago, my wife and I. It started because she got ill and we were trying to figure out what was wrong with her. I was an emergency room physician at the time. And I went and studied with a lot of different people to find out how people could be helped, and she got better. And our friends noticed it and they said, can you help us? And so it started as a little part-time thing, but it grew and now we have a big clinic and we get people from all over the world, really.
Yes, you've so many different alternative ways to look at health. Let's talk about cancer. You guys have a process called IPT. It's an alternative to, say, traditional therapies to treat cancer. Tell me about it.
Well, normally cancer treatments involve surgery and radiation and regular chemotherapy. But there's a lot of benefit that people can have if they pay attention to their nutrition. Many cancer patients are sick because their bodies are full of toxins, environmental toxins. They may have toxins coming from inside their body with parasites or infected teeth that they don't know about. These things diminish the immune system, so then they can't fight. Probably in all of us every day, there are cells that turn cancerous. And if the immune system is healthy and the diet is good and the environment is right, our body finds those and it takes care of them. But in people who have a lot of burden, you know, a lot of these other things, they're exposed to pesticides, their diets aren't good, they're eating too much sugar, they're stressed out, then these things can get missed. The immune system has too many things to do. And if it has too many things to do, it will miss it, and then these things start to grow. So our approach toward cancer is a very holistic approach. It's really important what they eat. It's really important the supplements. We have a way to actually get the cancer cells from the body through the blood and do very careful sensitivity studies on what is that cell sensitive to in the world of regular chemotherapy and also in the world of alternative therapy. So, you know, if you look on the internet, you can see lots of things that are supposed to kill cancer, but in one person's cancer, it may work, and in another person's, it doesn't. So this gives us a really kind of objective way to say, with your cancer, curcumin is good, or garlic is good, or ginger is good, but something else isn't good, so we wouldn't do that.
So it's almost, if I'm understanding this correctly, it's like customized treatment in a holistic approach.
That's exactly right. So, you know, if you're 50 years old and you have breast cancer, you are going to get a certain treatment if you go to a regular cancer doctor. Ours is going to be completely specific to you because it's interesting, but in each person, cancer is different in one than the other. While it may be pancreatic cancer or breast cancer or colon cancer, it's not the exact same disease in each person. The cancer isn't sensitive to the same things. So that if we can tailor make this to a person specifically, we feel we can do a better job at trying to help them get better.
Sure, and we're all so accustomed to that one-size-fits-all sort of treatment that seems that traditional therapies seem to offer.
That's right. That's
Gotcha.
right.
So what does IPT actually stand for?
So IPT stands for Insulin, Potentiation, Therapy.
Okay.
Now this was developed by a Mexican physician probably about 40 years ago. Because cancer cells, for the most part, require sugar to get their metabolism. Our healthy cells can eat fat and protein and sugar, but cancer cells prefer sugar. When someone has a PET scan done, they get an IV dose of radio-labeled sugar. The sugar goes to the cancer cells, that's how we know where they are, and there's actually a number that's given of how much sugar went to the cancer, so you can get an idea of how active it is. So a healthy arm cell, let's say in a breast cancer, a healthy arm cell will be 1, but the breast cancer might be 10, 15, or 20, which means that cell is taking up sugar a lot, it goes there, and then the scanner can read it. So insulin potentiation therapy is a way to, with insulin, open the doors of the cell where the sugar goes in, and then give chemotherapy, but in only about a 10% dose of what would normally given. But this cancer cell will preferentially uptake the chemotherapy in the cancer rather than in the other cells. So we get a concentration there, and we can use lower doses. This minimizes the side effects, because if you're going to treat cancer, you've got to be able to preserve the immune system in order for it to help you, because chemotherapy alone doesn't really cure cancer.
Sure. Wow, so fascinating, Doctor. So glad you're here. Is there anything that you'd like to leave our viewers with?
I think when people get a diagnosis of cancer, they get very frightened.
Sure.
And I think what they should do is go see a regular oncologist and get an understanding of what that therapy is going to be and what the success rate of that therapy is. And then come see somebody else like us and say, look, here's another way to look at this. This is a very personal decision about what therapy do you want. Some people immediately know, I'm going to go traditional. And I say, you know, God bless you, do that. Some people say, I just don't want that. I want to try something else. So then our actions seem to be better for what they want to do.